Jeff Slauson here from 19 News Now at the 19 News Digital Desk. Some positive news in a really awful area. Decreases across the entire state and across the entire country when it comes to opioid-related overdose deaths. This is the first time we've seen a decrease since the pandemic. The United States decrease was about 4%, but Ohio was at about an 8% decrease, a really massive number showing great progress when it comes to trying to fight opioid addiction and to prevent the amount of lives that we have seen lost over the last couple of years. We spoke earlier today with Dr. Zaid Fadul about this. He is the medical director at Better You, gives a fantastic interview, breaks down very clearly why we're seeing this decrease and what we need to do to make sure we continue to see some decreases like this. Let's take a listen.
You know, there's three reasons for that decrease. In my background, I appreciate you inviting me on. My background is primary care and addiction medicine, so I'm board certified in both. And addiction medicine is near and dear to my heart because in the end, everybody suffers from opiate addiction. So the three key reasons, I mean, one, there's much better cooperation with Mexican authorities and the DEA. And so they're cracking down on fentanyl. And a lot of times with addicts or people who are using these illicit drugs, they don't realize the potency of the opiate. So by the U.S. and the Mexican authorities working hard to, curb that potency and the cross-border migration of these drugs, it's helped. The second thing I've noticed is there's a significant drop-off because of naloxone. It's a reversal agent, and it became over-the-counter approved in 2023. And so what you saw over the next 6 months is a widespread campaign to increase people's knowledge. If you have a loved one in your family, it's important to be able to support them. And sometimes they push us to the edges when they're addicts. But having naloxone over the counter, and you just have some at the house and have some basic understanding of how to just inject somebody, has just unequivocally saved lives. And now you're seeing most first responders all carry it as part of, even police officers now are carrying 2 doses, not even just one, but 2 on their belt. So they have it available. That's been a huge improvement. The third thing I think is really, it falls back on us as providers. There is so much stigma around opiates that all of us, dentists, surgeons, internists, we have all been shying away from prescribing it. Even at Better You now, we've been championing a pain management program that moves away from opiates and giving patients alternative regimens. So there's a lot of factors that go together, and you're seeing it when you have really smart, effective cooperation between the public, between the government and security forces, and between the private sector. We're seeing that result in a 20% drop in overdose deaths. So I think it's pretty fantastic.
Yeah, I want to touch on the treatment differences that we are seeing right now. You mentioned the work that you're all doing and how it's not a different approach necessarily, or at least as broad as that may seem, but it's using different approaches, right? It's using different ideas on how to tackle this and not necessarily handling it in the way that it was traditionally done. Why do you think it is important to kind of adjust the way that doctors, providers do take on addiction in order to see the numbers that we are seeing right now?
It's a great question. I think a lot of us, all of us really, I'd like to believe we're just trying to help people. And we're in a position where we want to support patients. And what ends up happening is we're going for the tool that we know very easily. And a lot of patients will come in either asking for Percocet or something like that, or we know it will help. What we don't do sometimes, what we really fail at is educating patients that we're not trying to make them pain-free. We're just trying to knock their pain down. We're not sometimes very good at educating patients that opiates are meant to just be short-term, 2 to 3 weeks. That's it. It's meant to be a bridge. We don't tell patients, thoroughly sometimes that our pain scores may be a 7 or 8, but we're trying to knock it down to a 2 or a 3. And so they may have the wrong expectations. It's supposed to be a 0. There's a lot of alternative methods to improving pain. One of them is anxiety control. For a patient who's very anxious, they're much more sensitive to their pain levels, and now they're turning to a pill to help it. So even just talking to patients about their anxiety about when am I going to get better? How am I going to pay for this surgery? How, the other issues that can creep up and kind of get in their heads. I've got to get back to work. I don't want to lose my job. Those things can really start to drive up our anxiety. And so simple things like a deep breathing exercise when you're feeling that anxiety climb, and then reassessing your pain level, and then deciding, okay, maybe I don't need such a level of opiates, can be really profoundly impactful, but that takes time to explain to patients. And for patients, sometimes they don't want to feel like they're getting pushed off. And so providers historically have been, I think, shortchanging that explanation. And it's important for all of us to take a more holistic approach towards pain. So
when we look out, I mean, obviously these numbers are encouraging, but any number of overdose deaths is too many. So as we continue to advance into hopefully more and more decreases, what's needed for that sustained success? Is it ideas like you're presenting? Is it something that's kind of starting to become more well known? I mean, how do we continue this trend to start to see lower and lower numbers year in and year out?
I think it's important for families to get involved. I always think everything starts at home. And so if you have a spouse or a loved one that is unfortunately addicted or overusing prescription opiates, reach out and get support. Reach out to your local PCP, reach out to community resources. You may not know anything about naloxone. You may not know the warning signs to look for when you're supposed to give it. So I think it starts there. There's been a lot of community support in terms of policing, and I think that education has really been profoundly impactful. So, continuing to support the law enforcement and first responders, continuing to provide naloxone at easy access points. Naloxone is still expensive. Even if it's over the counter, you don't need a prescription anymore. There has to be more done to try and lower the cost, to lower the burden of access. And I think as providers, we need to just continually do a better job of having alternative pain medications. A recent one just got approved. First non-opiate pain medication just came out a couple months ago, and it was approved by the FDA. So there's different tools out there, and we as a public have to demand those tools. We have to advocate for ourselves and just say, hey, I know I have a toothache. I appreciate you giving me this opiate. Is there something else? Is there another option? So it's okay to ask your doc to try something different. I have a lot of patients that are worried about getting addicted, and they just always ask me. Anti-inflammatories help. Ice packs will reduce inflammation. That helps. Muscle relaxers at a low dose infrequently help. All these things combined will lower the burden of pain that you're experiencing. Better sleep helps. Like all these things work together to lower your pain threshold. So I think as long as we as a society take a holistic approach, we'll see these numbers continue to go down.
Right, because it's that idea as opposed to just saying, this is all mental, you need to figure it out. It's working with them and providing alternatives or different things, right? I mean, I feel like that is a fundamental change compared to what 10, 15 years ago the thoughts were on this. You mentioned the stigma around it earlier when we were in the first question there. This feels a lot related to stigma as well. I mean, does that continued effort to lessen the stigma around it, or at least change people's perception, can that work in conjunction with the numbers going down even more?
Absolutely. I think when I first got involved in addiction medicine in Cleveland 10 years ago, I had the absolute wrong impression of what an addiction patient looked like. And I don't think anybody wakes up in the morning looking forward to being addicted to heroin. Like, that's never how it starts. It's your sister who had a knee surgery and just got too many opiates. It's your high school athlete who's trying to stay on the field because he's excited to get a college scholarship, who wants to stay in the game. It's maybe kids, frankly. And when I say kids, because I'm so old now, I'm talking, teenagers and college kids who may go to a party and not know better, and they're doing pill parties. They don't know quite understand what those risks are. Everybody. Everybody is susceptible to getting addicted. It's just a matter of exposure to these drugs, whether it's irresponsible exposure or even responsible exposure where your doctor's prescribing it. You have a toothache and your dentist is giving you something to get you through for the next week until he can get you in. So all these things are risk factors. So no one's immune to being addicted.
Last thing I got for you is related to Better You. Explain to those that are unfamiliar with what you all do and the mission.
We are a holistic wellness company. It started out as using alternative methods to try and help people with mental health challenges. We've broadened our scope now. We actually have an anti-opiate program. We're just all about pain control. So we have some topical pain cream with some anti-inflammatory approaches, as well as mental health approaches. So we combine treatments for anxiety with topical pain relief. And we've seen a tremendous impact for our patients. We are always looking to support patients in their journey to just a better version of themselves. I don't want to see anybody get addicted to anything. And, the best interventions are short term, has been my experience for most things in life. If you break a leg, no one gets surprised if you wear crutches. If you're using crutches for the rest of your life, it's a little it starts to make you wonder why. And so we've taken that approach with most of our interventions. We try and find ways to help people, short-term interventions, medium-term interventions that give them a chance to take control of their health. And we try and titrate those programs specific to each patient.
You answered all my questions here. Is there anything we didn't touch on that we should have?
Um, I think the bottom line here is community, and I think it's important that all of us uh, remember the humanity of people who are addicted. It's very easy to feel hurt and almost violated, the sense that trust is violated by those loved ones, and to cut them off. And that is, terrifying for those people who are getting cut off. And I think that if we really want to help people, we just find the right resources and plug them in, and we can love them from a distance, but we can't stop loving those patients and those family members, because they need you. At some point, if they hit rock bottom and you're not there, it's not really rock bottom. So.
And as I said in the interview, one overdose death is too many. However, seeing a decrease is very important and very good news on that front. If you want more information on this, you want to see the full report from the CDC, head to our website. That's cleveland19.com. Also got much more coming today for the rest of the stories of the day. For now, I'm Jeff Slauson with 19 News. Have a great night. Much more to come, both on air and online.
19 News, now streaming on Samsung Smart TV. Search for